An early surge of respiratory viruses and sick kids is now straining resources at some local hospitals, especially in the Northeast. Here to answer questions is Dr. Kristen Moffatt, an infectious disease specialist at Boston Children's Hospital. Always great to see you, Doctor. Thank you.
Hey, Dr. Moffatt, great to see you. So we have new data from the CDC that shows a significant spike in the cases of what's called RSV.
Yep.
So what do parents need to know about this virus?
I think it's most important that parents know that this is not a new virus. This is respiratory syncytial virus. It's for a long time been one of the most common viral causes of respiratory illness in children, especially young children, typically starting in about late fall and going right up through the winter. So we are seeing this uptick in RSV a bit sooner than we would have expected to in pre-pandemic respiratory viral seasons. In most people, it causes an upper respiratory infection, but RSV can move into the lower airways in the lungs, and that can lead to some difficulty, particularly for very young infants or young children with certain underlying medical conditions. But I would just encourage parents that we know this virus, we know how to care for children who do need hospitalization with this virus, and that even those who require hospitalization tend to do very well with oxygen and hydration support.
I think parents need to hear that.
Good to
That's
hear,
comforting,
yeah.
for sure. But your colleagues, though, Doctor, at Connecticut Children's Hospital are saying they are overwhelmed right now with young patients who need to be hospitalized. And right now they're actually deciding whether or not to put a mobile field hospital on their front lawn. So how does their situation compare to the ones where you're at?
Yeah, children's hospitals everywhere are really
Yep.
feeling the squeeze right now, and that's reflected in our very busy emergency departments and inpatient units. Boston Children's Hospital is not isolated from that. We also are very, very busy right now, but fortunately not yet to the extent that our colleagues in Connecticut are.
So let's talk about it. And this is important. RSV is important, but let's talk about other seasonal viruses that may be out there right now or about to emerge as we go deeper into the fall and into the winter. Which ones cause the most trouble for kids?
Yeah, it's a great question. I mean, I think we've all gotten very used to testing for viruses, which in reality and before the pandemic, the overwhelming majority of viruses we either didn't have tests for or didn't do those tests very regularly. So that's because most people do very well with these viruses and get an upper respiratory infection or even maybe a little bit of lower airway involvement, but can still be managed at home. The ones that, even though it's still a minority of children who get these infections that require hospitalization, but can lead to that, really are influenza and SARS-CoV-2. And then, as we said, for the very little ones, RSV. So it's really important when we think about those three biggies. When it comes to influenza and SARS-CoV-2, we have vaccines that are very effective at preventing hospitalization with those viruses. So I really would encourage families to keep as up to date on those vaccines as possible.
Doctor, most respiratory viruses usually cause some version of a cough and a runny nose. So in your experience, with your expertise, which symptoms are more serious and should definitely be checked by a doctor?
Yeah, that's a great question. And when you think about the respiratory symptoms parents should look for, it really goes beyond the cough and the runny nose. So you really want to be looking at their work of breathing. And that means, does it look like they're using extra muscles to breathe? In little ones, are they like sucking in the muscles in between the ribs or using belly muscles to breathe? Does it look like their breathing rate is really fast? Does it look like they are getting dehydrated? That can be another thing that can really get children with a respiratory viral infection into trouble. So any of those signs would be concerning enough that parents should talk to their pediatrician or have an evaluation right away.
Notice and trust the signals. Dr. Moffatt, thank you very much. Great to see you.
Thank you, doctor.
Appreciate
Stay
your
well.
time. Take care.
Thanks.